everyone. Welcome to The Doctor is In on CNN Philippines. I'm Dr. Freddie Gomez. Now, we all can agree that exercise is important for our overall health. But running may not come immediately into mind when we talk about exercise, especially at this time when everyone is advised to stay at home. CNN's Chief Medical Correspondent Dr. Sanjay Gupta shares some tips on how to make running or jogging healthy as well as safe, even when outdoors. Let's watch this.
The biggest thing is right now, in most places around the world, we're in mitigation phase, meaning we're just dealing with the virus, we're dancing with the virus as some have described it, but it's all about trying to slow it down. Ultimately, we want to be in containment phase, and that means basically trying to put a box around the virus and contain it. In order to do that, you got to find people who are infected right away. They have to be isolated, right. And then people around them, their contacts, they have to be traced. And the key to doing that is testing. You have to have the testing.
Now, staying active also helps strengthen your immune system. And right now, that's one of the best ways to fight any kind of infection, including COVID-19. So in this episode of The Doctor is In, I would like you to understand how important it is to have a healthy and strong first line of defense, which is your immune system. So joining us today, we have Dr. Khlaire Pioquinto. She specializes in pediatric medicine from the Medical City. Hello, Dr. Khlaire.
Hi, Doc Freddie. Good afternoon. Hello also to all your viewers.
Great. Yes, glad you could join us today. Now, Khlaire, how does our immune system fight off threats, including COVID-19?
Sorry, can you repeat your question?
Yes. How does our immune system, how important is it in fighting off threats of viruses and bacteria, including COVID-19?
Okay, so your immune system, think of it as the army of your body. So when a pathogen comes in, usually it contains the antigen. What your immune system does is it will develop what is called the antibodies. These are specialized proteins. So what happens is that these antibodies will fight the infection. It's not always going to make you ill-free, or it's not always going to make you not manifest the disease. But what your immune system will do is it will hasten the recovery of your immune system of the disease. Another thing that your immune system does is it helps you develop what is called the memory cells, or the long-term immunity, through the use of your memory cells. So what happens is that when with these antibodies, the next time you're going to get the same infection, your immune system will know what antibodies to release to fight off the same infection.
Now, we often get questions on how to strengthen the immune system. But first, what are some of the signs of a weak immune system?
Okay, so since I mentioned earlier about the, hastening the recovery from an illness, so if you have a weak immune system, you'd notice that your child is always at the clinic, at the doctor's clinic for an illness, for a disease, like he always has fever, he's always sick with cough and colds, always has a bout of flu, and it takes him or her a long time to recover from an illness. So that's one of the signs of a weak immune system.
Great. Now, Khlaire, if you could join me, let's see some of the video questions that the viewers have sent in. The first question is from Let Ocampo. Let's watch this.
Ako po na 9 years old, lalaki po siya. Kumakain naman po siya ng gulay, ng meat, pero parang sa tingin ko po ay parang kulang yung, hindi siya masyadong malakas kumain. Tanong ko lang po kung anong magandang vitamins na pwedeng ipainom sa kanya para naman po ganahan siya sa kanyang pagkain.
Okay. Yung paggana po sa pagkain, it's not, we don't usually rely on the vitamins. Ang ina-advise po namin ng pediatricians would be tsagain nyo po yung pag-feed sa kanya and don't force feed the child. As long as the weight and the height is within the normal limits, hindi naman po kailangan talagang patabain yung bata or talagang malakas na malakas kumain. As long as is getting a healthy, balanced diet, that should be enough already. I mean, but if you really want vitamins, you could give any multivitamins naman containing vitamin C and zinc that will boost the immune system.
Now we have another question, video question from Oliver.
Meron po bang mga specific na exercise routines na makakatulong na magpalakas ng immune system?
Nothing specific naman. What the WHO recommends would be 30 minutes of vigorous or moderate to vigorous exercise per day. That should get your heart pumping so that your blood gets circulated throughout your body. So any cardio exercises, you can run around the village if it's allowed. Or you can just, if you have stairs at home, you can go up and down the stairs or any exercise. There's Zumba. There are a lot of free online classes these days. So you take advantage of these free classes.
Now, Claire, a question about sleep, because we all know sleep is also important for the immune system. Ngayon na ECQ, ano yung magandang time frame? What's the ideal sleeping time para sa mga bata now that may ECQ tayo? Nasa ECQ tayo.
Okay. Same pa din. Even if we're not in ECQ, the ideal number of hours for a teen would be about 8 to 12 hours, 8 to 10, average of 10 hours. For an adult, at least 7 to 8 hours. Kaya-kaya naman natin because, you're just at home, you're supposed to be staying at home so you can sleep, for some who can. For kids naman, more than at least 14 hours, including nap time na yon.
Okay, so just because nasa ECQ tayo doesn't mean they can stay late longer. They still should follow their sleeping habits. Now we have to pause for a quick break, but after the break, we'll talk about vaccinations and why it's very important for your child's health. Stay tuned, we'll be right back. Welcome back to The Doctor is In. Earlier, we talked about how our immune system works. Now we'll discuss vaccines for children and how these help the fight against infections. According to UNICEF, last year, over 13 million children did not receive vaccines at all. They're calling on governments to step up and implement the immunization programs, especially now that the COVID-19 pandemic delays the immunization services that could leave more marginalized children without access to these life-saving vaccines. So still with us is Dr. Khlaire Pioquinto. She's a pediatrician from the Medical City. Now, Dr. Khlaire, going back to our discussion on vaccines, how do vaccines help to strengthen our immune system, especially the immune system of children?
Oh, okay. So these vaccines, once you get them, it's like getting the actual infection, but you're not getting the symptoms. So what we do is we inject either the antigen or the toxoid. It depends on the vaccine you're getting. And then, if you remember earlier, I mentioned about the antibodies. So what your immune system does is when you get the antigen or the vaccine, your body will still produce the antibodies. So it's like you're getting the infection without actually getting sick. So once your immune system develops the antibodies, and then later on in the future, if you do get exposed to this infection, to this type of bacteria or virus, your body will know how to fight off the infection.
Now, what happens when children don't get vaccinated?
Okay, so these vaccines are very life-saving. If they miss their vaccination, they could risk getting the infection itself. And these are vaccine preventable diseases. So in this day and age, there's really no excuse for us to get measles, polio, meningococcinia, because these vaccines are readily available and some are actually free. You get them from the health center for free. So it's not just getting the infection that's scary. There are also complications when you do recover, or if your child does recover from an infection. Take for example the H influenza B or the Hib. This is already included in the 6-in-1 vaccine, one injection. So this infection, one if your child gets this infection and he or she is not protected from this infection, she could get meningitis, which is an infection of the lining of the brain. This can cause seizures, developmental delays, profound hearing loss later on. So we don't really want that because, this can alter the life of the child later on, diba? So it's really hard to manage that. And then you can get pneumonia, which is also very fatal. So, you can easily get protected from it if you just get the vaccine.
Now we'll move on to our social media questions. We have a video question from Charmaine Lim. Let's take a look at this.
Po kaya kung may mga na-miss na vaccines yung mga bata ngayon, pwede po bang ibigay yun sa pagkalipas ng ilang buwan?
Yes, we do have catch-up vaccines. We can, you don't have to, kunwari you started the vaccines early on, like infancy, and then you stopped. You don't necessarily have to go back to zero, like start from zero. It's not like that. You can catch up the vaccines that you missed.
Now we have another question from France Daniel Aguilar.
Ask ko lang po kung anong food or diet plan yung ma-recommend nyo para maging better yung immune system namin for this situation.
Sorry, one more.
The question was, Daniel Aguilar was asking if you could recommend a diet plan na maging mas better ang immune system nila, especially sa ganito.
Okay. Well, we always advocate a healthy, balanced diet. So, a diet that has carbohydrates, proteins, and a large portion of your plate should be the fruits and vegetables. So, ideally, we don't really want those preserved canned goods. So, we want them freshly prepared at home. So, kayang-kaya naman these days since, you have time to do gardening, and so you can get your harvest, you can harvest your fruits there, your vegetables. So, yeah, a balanced diet. Hello.
Hi, Dr. Khlaire, are you there?
Yes, I'm here.
Yeah, sorry. Before, last question is, normal lang ba ang lagnatin ng isang bata after bigyan ng immunization shot?
Sorry, normal ang?
Ang lagnatin ng bata. Normal lang ba ang lagnatin ng bata after mabigyan ng immunization shot?
Yes, it can happen. Fever, sometimes swelling on the injection site, or warm or redness can happen. But these are all very temporary and mabilis naman siya mag-recover. And not all vaccines cause these anymore. It's very easily managed by paracetamol, and you don't usually get high-grade fevers from it.
All right, now we have to pause for a quick break, but after the break, let's answer more questions on how to boost your immune system, and we'll discuss the need to continue the immunizations despite the COVID-19 pandemic. We'll be right back.
Welcome back to the Doctor's Inn. Now, before we continue the discussion, there's this interesting video that simulates how far germs can actually travel from a cough. CNN's Randy Kate tells us more.
Inside this lab at Florida Atlantic University, 2 engineering professors are measuring the power of a cough. Using a dummy, they fill its mouth with a mix of glycerin and water. Then, with a pump, force the dummy to cough. Then wait to see how far the droplets travel. They fill the air, visible with the green laser light, simulating what happens when we cough. Take note how quickly the simulated respiratory droplets spread. The droplets expelled traveled a distance of 3 feet almost immediately. Within 5 seconds, the droplets were at 6 feet, then 9 feet in just about 10 seconds. Remember, 9 feet is 3 feet beyond the recommended social distancing guidelines. The fog of droplets lingered in the air, but kept moving forward, taking just another 30 to 40 seconds to float another 3 feet. Yes, he said 12 feet. Over and over again, the simulated droplets blew past the 6-foot mark, often doubling that distance.
Now, the Center for Disease Control and Prevention recommends standing 6 feet away from other people, at least 6 feet from other people, and wearing a cloth face covering when social distancing is difficult, like at grocery stores and pharmacies. Kaya sa panahon na ito ay dapat ay palaging malakas ang ating immune system bilang depensa sa anumang sakit. Early in the program, we discussed what vaccines can do to help your child or how to build your child's immune system to be strong and resilient. Now we want to emphasize the need to take vaccines despite the COVID-19 pandemic. So still with us is Dr. Khlaire Pioquinto. Now, Dr. Khlaire, why is it important to still continue the immunization program for children amid this pandemic?
No, Doc Freddy, the healthcare system of our country is already very overwhelmed with the COVID-19 pandemic, with this crisis. So we do not want to add more burden to this already overwhelmed healthcare system. So we do not want to see an outbreak of measles, polio, and other vaccine-preventable diseases during or after the COVID-19 pandemic. So, it's also our way of helping the country by staying healthy.
Now, a lot of parents are probably wary or cautious about bringing their kids to the doctor for immunization for fear of being infected. Now, are there any precautions now? I know you're practicing in a clinic now and you do vaccinations every day, still see patients every day. Are there other extra precautions that you follow to help the safety of your patients?
So what I do now is all my patients for well baby, well child, or wellness checkup, they're all by appointment. So to make sure that they're the only ones na nandito sa clinic. So I start my clinic hours at 2 p.m. So I give at least 30 minutes and that maybe 10 to 15 minutes to disinfect in between. And then we call in the next patient so that they're the only ones here inside the clinic and that we make sure that everything is clean. I wear my gown, my face shield, my face mask, my gloves, just to make sure that, there's no exchange of any infection. So I sanitize everything that I use, my stethoscope, after every consultation. So there. Strictly, we do not allow any walk-ins if for well child checkup only.
Now let's answer some questions we have online and on social media questions. We have a question from Twitter actually, and it says, "Hello, doctor. Would would you say that sticking to a plant-based diet is a safe thing to do at the moment?
A plant-based diet. Um, I suppose if you get the complete nutrients from it, because you also get proteins, you can get your vitamins there also. Just as long as you make sure that you get the complete requirements, daily requirements for for a growing child. But for me to suggest you to
And
have
here we have
purely
not
based diet, it's not it's not up to me. I would still suggest
great.
a balanced diet, yeah.
A complete balanced diet and a balance of everything for your child. We have another question from Sebastian.
How to boost the immune system if only sardines are available to feed their families on this pandemic. Hmm. Well, like what we mentioned before, you can exercise, you sleep well, that's a way to boost the immune system. You can get vitamins, but of course, if you can afford to buy vitamins, you should instead buy the vegetables at the market. So I don't believe that you only have sardines as an option. I mean, if it's a relief good from your LGU, they also give vegetables. So um, I would probably not advise a purely sardine diet.
Okay, so yeah, I apologize for the technical difficulties we have. I know, Dr. Khlaire, but thank you for sharing your expertise with us, especially now, to just emphasize how much the immune system plays a role, especially for our kids.
I'm happy to be here to shed some light
And to thank all of
on
those
this.
also who said, hope that we're able to give you at least some helpful answers. So we'll see you again tomorrow at 3:30 p.m. here on the Doctor Is In. I'm Dr. Freddie Gomez. Thanks, everyone.